Hi everyone, good evening, and thank you for joining me tonight at what I know is a pretty challenging week for everyone, across Melbourne. Obviously, with things escalating as they are, it's been a really stressful time for everybody, and I'm really grateful that a number of you have managed to join me tonight. I think it's sort of important equally at times to focus on non-COVID related news and to sort of remember that in some ways, life really has to continue, and it's nice to be able to hear about other things and to talk about other things. And I'm really glad that you're able to join me tonight for a chat about a topic that I'm very, very passionate about. And my passion for this area derives not only from my professional interest in it, but also from my personal interest in this sort of in this field. As I think a lot of you know already, I'm a very lucky dad to a beautiful 15-month-old girl. She's 15 months tomorrow, in fact, who is the product of IVF. And my wife and I were one of the 1 in 6 couples who suffer infertility, and having been through it myself, I feel a real empathy for couples and women going through fertility struggles. So I'm absolutely thrilled that I am joined tonight by the wonderful Laura and John, who themselves are going through infertility and the process of IVF. And I think hearing about it from a patient perspective is just so important. I think it's one of those topics that a lot of people find very difficult to talk about, and knowing that there are other people out there experiencing the same thing makes it a lot easier to go through. So I'm going to get John and Laura to join me now. Good evening.
How are you doing?
I'm really well, thank you. How are you both at this slightly challenging time in Melbourne?
We're good.
Yeah.
Excellent.
Yeah.
Absolutely.
Right, definitely.
Mm-hmm.
Definitely. I mean, you're both sort of working at the moment, staying home. How's life sort of changed for the two of you with all the restrictions at the moment?
Well, for me, I'm on the ambulance, so it's quite busy out there.
Absolutely.
And I guess for Laura, she's got herself busying herself at home.
I've been sewing face masks, so
Fantastic, and they're absolutely brilliant. I've seen a lot of them on Instagram, and it's really funny. I had a patient who came in the other day. She needed a postnatal check, and she was wearing a mask, and we all said, "Gosh, that mask is amazing. Who made it for you?" And it was you. So it's a very, very small world. So no, you're making a great contribution. So thank you for that, and thank you both so much for joining me tonight to talk about a topic that I feel very passionate about. And as I was saying just before I got you to join, I'm passionate about it both professionally and personally. As you know, I've been through IVF myself with my wife, and we're very lucky to have a little girl at home who's the product of IVF. So I feel a real connection with this topic, and I am just thrilled that you could join me tonight. And when I was thinking about being able to talk with people in an open forum about it, on Instagram, having seen both of you on social media, I thought that you would be the perfect people to talk about, because you seem to perfectly be able to combine, a little bit of humour, sensibility, and just a good take on what it all entails. And I thought a lot of couples would be able to really relate to your story in some way. And I thank you very much for being able to share it with us tonight.
Appreciate it.
Yeah.
No, thank you.
Excellent.
We didn't share anything for about a year when we first started fertility treatment, which I think is quite normal for couples who keep it quiet at the start. But we just got to the point where we're like, this is hilarious and ridiculous and horrible. People would know about this. So
you're absolutely right. I echo that. I think we were exactly the same. We certainly didn't tell anyone for a while, and I think it was only when we sort of made the decision to start IVF that we sort of thought it's important to tell people, because we're going to need their support as we go through it, and we certainly found that a lot easier. I know I certainly did, and I sort of shared it with a lot of people. And it's hard, I think, when you start telling people, you're not sure how much to tell them, and you're not sure how comfortable they feel hearing your story. But I think the more that I sort of got it off my own chest, the better I felt, and people really acknowledged that, and it was great having the support of our loved ones around us. So I agree.
You do
what was that?
You do get some glazed over looks when you start getting down the rabbit hole a bit too much.
You certainly do.
I've overshared.
TMI, I'm going to take a step back.
What is oversharing? But I think that it changes all the time as well. Like sometimes you're like, oh, I wish everybody knew. And sometimes you're like, oh, I wish nobody knew.
Definitely.
We actually started with a private Facebook group of just 16 people that we wanted to share it with. We found that helped at the start because we wanted to be able to, sometimes we didn't want to have to tell each person individually as well. So just being able to say, here's what happened. That's all you need to know. Don't ask us about it.
Fantastic.
Was really helpful. And then from there, we found, like, we sort of found ourselves enjoying sharing it and being funny about it because, like, it's nuts what we go through. And so we thought, well, if we can put a humorous spin on it,
absolutely,
it's
brilliant.
And page, then maybe help other people see a lighter side to it because it is heavy, it's hard, and you got to do what you can to make it easier to get through.
I couldn't agree more, and certainly, I'm not going to sit here and say I had a fertility journey that was nearly as complicated or difficult as yours. We were very lucky in the whole scheme of things that, we had, one cycle and one transfer. And, I therefore, can't pretend that we had as many cycles as you have. And we've been through all of that.
Their journey. And I think it's hard no matter what, whether you do 25 cycles or one, whether you have one loss or none, it's hard no matter what. So, like, we have people come to us and say that quite a lot. They say, oh, we haven't been through, but it's hard because it's your experience. So
spot on. I completely agree with that, and thank you for acknowledging that for all the people that are going through some sort of fertility struggle. What I thought might be a good way for us to sort of kick off tonight is for you to tell everyone watching a little bit about your fertility journey and how it all started and where it's sort of up to now. And I thought that might be sort of a good lead into the rest of our discussion tonight. So if you're happy to share, as I say, whatever you're comfortable sharing, I think a lot of it has been shared already. But if you're happy to talk us through sort of where you're up to, that'd be great.
Well, you should tell because it's your story initially. I joined later. I thought that looks fun. Let me join that.
Haven't regretted it for a second, I'm sure.
I guess for me, unbeknownst to myself, it was probably something that came from childhood or from my teens, but it wasn't until 2011 when I got diagnosed with testicular cancer. So that week was hectic for me. I ended up under the knife within a week, and so for me that changed a lot. From there, we didn't. Now, if people wanted to ask, we didn't think about putting any sperm away because I thought, oh well, it's going to be fine. I think the doctor potentially thought that as well. And it wasn't until later when I was just looking into it, and then I found a specimen. I went and gave a specimen, and it had donuts. It was just all zeros.
Wow.
And, I started questioning. Oh well, maybe I can't have kids, and it wasn't really until I met Laura that. Well, it was our first date, and I said I can't have kids, basically. She was talking about kids because she loves kids. Do you want kids? And I pretty much said, well, I can't have them.
And I figured that I just have, like, selective hearing, because I went, oh, that's interesting. But I'm like, I always...
Let's move forward, It's a pretty intense way to start a first date, let me tell you.
I asked a question that I've learned to ask a lot and have asked a lot through infertility, which is that really true? And I asked John that, is that really true? Have you had it checked? Do we know for sure? Is there any new way of getting this done? And he went,
that little question, all it did for me was it just set me on a bit of a path to go, well, hang on, I've made a few assumptions here, and my urologist, my doctor, my oncologist, they were great doctors, and they did the best by me. Though, again, at that time, I heard what I needed to hear, and I heard, oh, well, we're not having kids. I can't have kids. That's the easiest route. So, for me, after speaking with Laura that time, I've gone and found a GP. I didn't have a GP since and I had to, that was the specimen. And then Off we go. Here we go. I go and pick from Dr. Google, who's the closest
Dr. Google, my biggest enemy at the moment.
But and remember as well that we just started dating. So we were like on our third date, and he's going to give a sperm sample, and it's like, what? And like, I remember when a pamphlet with a big giant sperm on the front just was sitting on the counter. I'm like, what's going on here?
This is intense.
But you know, we're sort of a bit older, and we both know what we want. We both know what we're looking for. We both dated horrible people, and we knew when we met each other that there was something there. And one of the best things about our situation is that we didn't sort of waste any time. Which is, I think that would be my biggest advice for people is just go and get it checked out, because you never know. The fact that John already knew he had an issue in a way was easier than spending a year or 6 months trying.
Absolutely.
Because, I mean, you could fill us in more on this, but there's some pretty simple tests you can do just to get started, right?
Absolutely. I completely agree. And I say the exact same thing to couples who, you know, are unsure about whether or not to see as an obstetrician, for example, for sort of pre-pregnancy counselling. And I always say to them, you know, coming to see me doesn't commit you to doing anything. All you're doing is gathering information so that you can then make choices that are right for you. And it's the same about seeing a fertility specialist. I must admit, we chose to see one pretty early on in the piece. And I think most of that related to my paranoia as an obstetrician, having seen a lot of infertility. You know, I must admit, initially my wife said, why would we have any trouble conceiving? But my, you know, instinct was after, you know, 3 months of trying to think something must be profoundly wrong. And we went to see our fertility specialist after 6 months. And at the time she sort of said, we can do something if you'd like, or you can keep trying. And, you know, we didn't feel ready at that point in time to actually have IVF. But having seen her made me feel so much more relaxed and reassured that at least we had a plan in place for when we did potentially get to the point of needing help, that it wasn't going to be starting from scratch. It was all, you know, there was a plan there already. And I felt so much better about doing that. And I say the same to couples who are trying to conceive. You know, yes, we often say you can try for 12 months before we identify it as being, you know, infertility. But really, you know, if you're anxious about things after 5 or 6 months, there's no harm in seeing someone. It doesn't commit you to jumping into IVF the following week, but it means that at least you can establish a plan. And I think that gives a lot of couples that reassurance and confidence that, you know, things are okay a lot of the time, and that, you know, and that things will be okay. And I certainly, we found that personally.
I think for us, friends and family who have, I guess, like yourself, they've just realised they've gone, oh, things are a little difficult, and I guess with us sharing, they've come out and actually spoken to us about it, and we've got a little joke that probably there's probably 4 or 5 people, 5 or 6 couples actually who have ended up, they've actually got their children now. So our little joke is that when we talk to them, we go, well, you talk to us now, so there's every chance you're going to be pregnant next month or next week.
Literally, as soon as they chat to us about fertility, bam, pregnant.
Straight away. Oh, yeah.
Like a lucky charm. So, but,
absolutely. I mean, it seems definitely, it seems a very common theme, and I want to talk to you about that in quite a bit more detail shortly. But, you know, it is hard when you're going through it, and it doesn't seem to be, you know, as hard for anybody else. But that's something that I certainly want to come to shortly. So I'm going to park that for a second. In terms of your fertility journey, so where are you up to now? How many cycles of collections have you had, and what's sort of the aim for the two of you before you can, you know, actually go through the process of, you know, having adequate egg and sperm, etc., to move forward?
Yeah. So me not having any sort of diagnosed fertility issue, I thought, okay, well, we'll do one IVF cycle and it'll work. And I think that's part of the reason why like you suggest that people get started early, because you don't realise there's, you know, sometimes a 3-month wait to see
huge
a doctor.
Process.
And then for us, we didn't.
Well, the paperwork as well.
Yeah, you've got to do the paperwork. We didn't.
Definitely.
Counselling and.
Yeah,
it's a long process. It is.
It takes a while. You may as well start the process.
Definitely.
And our first doctor we didn't quite gel with, so we decided to switch doctors, and I did a lot of research on different doctors. So it took us a while to even get started. And then when I did my first cycle, suddenly it turned out that things weren't as straightforward for me either. And I still don't really have a diagnosis, except that I just produce just
a low response.
A low response, particularly at the start. which was a surprise to me because, like, my mum gave birth to 9 children.
Wow, are you one of 9?
7 twins. I have an adopted sister, so I have 9.
Wow, unbelievable.
Yeah, and most of them are female, and they're all having babies, so that's awesome.
And really easily.
But so I went in thinking it won't be a problem, and then it turned out that it did take a little while because with our particular case, John needs to have a procedure called a microtesy, which is basically, we kind of jumped all the way to the end. He can't produce sperm the normal way.
I did. So basically, we moved on, just to go back a bit. We had that one, like, we had the specimen, it was 0. Then we found this doctor who recommended we do a fine needle aspiration. And literally, we made our decision moving forward that he found 1 immotile sperm.
Really?
On a blind, the blind procedure.
Wow. I do, absolutely.
One sperm. So for me at that time, because I was still thinking I didn't have any, I'm just like, yes, where there's one, there's got to be
must
more.
We were dancing in the street that day. And maybe if I'd known what I know now, I might not have been dancing. Like, it was a lot. We had 1 sperm, so we were like, let's go for it. But then it's been a long journey since then.
Of course. When did you start your IVF? How long ago was that now?
It would have been March.
No, it was
18.
December. Well, yeah, John started getting his procedures in March 2018, and then
It's a long time.
Yeah, I started IVF in because our relationship was still developing.
Of course.
As well.
Yeah.
I started IVF in December, and
I was hook, line, and sinker.
Yeah.
Done. Knew the moment you met.
Yeah, I finally had known what I know now.
No going back now.
I mean, well, we went into our first IVF cycle, and the doctors were like, okay, so John will have his microtesy, and because sperm is quite difficult to freeze, it doesn't freeze as well as embryos do. Their suggestion was that we make embryos and then freeze those embryos, which meant obviously that I had to jump straight into IVF. So we went in, and the plan was that John was going to have his microtesy on the same day that I had my egg retrieval. I went in for my first follicle scan, and there weren't a lot of follicles.
Right.
And the one thing I appreciate about this particular doctor is he sort of said, look, I think we need to stop here. This isn't going to work, basically. You don't want to have just, 5 eggs and John's, because you can only do a microtesy once. That's what people don't realise. So we stopped that procedure, and we went and sought out a different fertility specialist. Lots of people will know we moved over to Linda Meister, who's been awesome for us. And she said, no, we need to change strategy here. We need to freeze a whole lot of eggs before you do the microtesy.
Which makes sense at the end of the day. If you've got one shot, you'd hate to get, like what was going to happen. You end up with 6 eggs. And then they go in and they find 200 sperm, but we can only use 6 eggs, and we have to throw the rest out.
That makes complete sense to me. That's all right. It's a family affair.
So then we started egg retrieving, and basically we just did retrieval after retrieval, and we kept trying different protocols to get as many eggs as we could. And it was, I once heard it said to me by the counsellor, actually. She was like, how do you feel about the fact that John's the one with the fertility issue, but the burden of treatment lies with you? And I'd never heard that phrase before, and I was like, that's a really interesting way to put it. And I think that happens quite a lot with male factor infertility.
Absolutely.
The treatment ends up with the woman. So I was, basically like, wow, this is me. This is my life, and it has been for the last 2 years.
It's a long time.
Yeah, I've actually done 13 cycles so far. And I've this year, since January, thanks to COVID, I've been out of work. So I've been doing them back to back since January. So I haven't had a month off at all. So I'm up to my 7th for the year. And I had my injection before we started. So I've been doing daily injections, and every month, every 4 weeks, I go into the hospital and I have another surgery under a general anaesthetic. So Lynn's been great. She's gotten the protocol working quite well now, and I'm producing more eggs now than I was initially.
Great.
Perfect.
Good.
But it's been quite interesting through Corona as well. With the situation in the hospitals changing quite a lot over time. We don't know whether the science
and my procedure as well.
Absolutely. Absolutely. Yeah. I am delighted that, you know, fertility treatments have been considered, you know, urgent and required at the moment, because I think when they were halted, you know, when everything sort of started a few months ago, I think that was so difficult for couples going through infertility. And I sort of put myself in that position and thought back to when we were going through it all. And I know I would have been absolutely devastated to have been told that, you know, the cycle has to be halted or postponed. So I'm really delighted at the moment that it's able to continue, because I think it's such an important thing. It's not like other treatments. I think there is a time frame on it. There is, you know, urgency, and I'm really glad that it can continue. But I think the amount of stress that it's caused for couples who are going through it all at the moment must just be enormous. And, you know, I certainly can tell with all my pregnant women that it's such a difficult time to be pregnant. And I think trying to get pregnant at the moment is equally very hard for people. And the thought of potentially having to wait longer, you know, for a couple who's already been on this journey for 2 years must be really hard.
Yeah, and I think that highlights even more how much the fertiles don't understand the process. And, you know, the politicians don't understand, because for us it's not even about just waiting, it's about the fact that it's scheduling. You know, John has to schedule with my doctor, and
absolutely
suddenly everything gets blown up. Plus it's all got to line up with my period and my cycle, and
100%.
You can't just turn it off and turn it back on again.
That's right. And with work, for John, like you know, you plan the rest of your lives around fertility treatments. It sort of becomes very dominating in terms of how you organise the rest of your lives. And I agree with you. I think that in order to be able to plan things, it relies on very precise time frames. So I'm really happy that it can continue. So when are you scheduled for your next pickup? When will that be at the moment?
Well, I mean, that's the other thing about right now. Right now, fertility treatment is working for me. In 6 months' time, I can't be so sure. So
absolutely.
That's why I don't want to stop. I'm on day... so my cycles run really long. I tend to go into egg retrievals on day 20 of my cycle. So I'm on day 8 right now. It's actually, we got through day 7. Day 7's usually the day that I lose my...
I move out day 7.
Done so many cycles, we've noticed patterns. And on day 7, I usually... I've had like... just sitting on the floor crying for no reason.
Flying to pieces.
So you must be thrilled that it's day 8 today then.
We'll finally work out and go, oh, I know what it is.
That's what's happening. Hump day is over today. Well done, my friends. Really good.
That's been the fascinating thing about doing so many in a row, because I know exactly what's coming. And we actually got through day 7 without me completely losing my mind.
No, you were good, but you've been focused on the face masks as well.
Yeah.
It's been a nice distraction for you.
I know what physical feelings I'm going to feel, like what days I'm going to feel bloated. And
absolutely.
I know when I have my last day of freedom, like when I still feel good, and then I know that by tomorrow I'm going to feel a bit rough again. And that's
absolutely.
But
it is funny, the conversations that we have, and they're the same conversations, and Laura goes, oh, I can't ever remember saying this or feeling like this, and I'll just look at her and I go, it's the same. I'm like,
I like
really? I feel really good. And I'm like, yes, you do. It's amazing.
Like childbirth, we're programmed to forget everyone what we
definitely. Exactly right.
And it's been pretty amazing to have our relationship under these sort of in this environment for 2 years now.
Absolutely.
You know, we're taking additional hormones and just feeling sick a lot, and even for us, the fact that I'm sort of having to do the majority of this IVF process for John's situation, and how that impacts on our relationship has been
absolutely. It's an excellent point you bring up there, and one that I sort of share with all of the couples that I look after. I don't do fertility treatment myself, you know, in terms of IVF. I do ovulation induction, but once couples need IVF, I send them to specialists like, you know, CREI qualified people like Lynn, for example. And I always say to couples, though, that, you know, even though often the sort of emotional journey is shared, the physical burden largely falls on the woman. And I think, you know, in your scenario, the amount, you know, of procedures and hormones and injections that you're going through is enormous. Having said that, John, you're equally doing probably more than a lot of men have to do in their own IVF cycle. So I want to recognise that for you as well, because for most men going through IVF, it's actually a very straightforward process. And, you know, as you said, you have to have a procedure, and you've had a difficult history that most people would never wish upon themselves or anyone else. So, you know, you both deserve a lot of credit here. But the physical burden often falls largely on the woman, but the emotional burden can be shared somewhat, and it's really important to recognise that you can try and help each other through what is a very, very difficult process. But it has you know, an effect on relationships, and a lot of couples say to me that they find that it has brought them so much closer together, whereas other couples find that it is really hard on their relationship. And I think that, you know, it certainly helps going into it with a strong relationship. You guys went in with a very early relationship, seemingly, and it's been fortified by the process that you've been through. But yeah, it's a very good point that you make, that you know, sort of, the woman does have to bear the physical brunt of IVF usually.
I think on top of that, I give her credit where credit's due. Definitely, it's amazing. And I think for myself, going through this process with Laura is I think for me, like, even being a man, I can bring ego to the table a lot of the time, and I believe that potentially is where a lot of people get into trouble. So if I think for me, once I realised it's not personal, there's nothing personal about it, then I was able to just move on, and then actually console her and go, geez, man, you're going through a hard time. It's not about me. It's about where we've got the same outcome at the end of the day. If you want a bunch of little ones running around, absolutely. Why am I feeling like I'm getting threatened? And that's not the case at all. We're going through. We're under stress. We're tired. She's had 1,000 injections, whatever.
Absolutely.
It's just like
I think that's part of why we wanted to start putting our story online, and having a YouTube channel and doing the Infertility Man stuff, and with a focus particularly on men in this process. John really wanted to share some of his insights, because he has been doing a great job, and as a paramedic he's able to help with the injections and all kinds of things like that. But that was my job too. We were surprised at how sometimes men don't engage in the process. And, you know, how often we saw women really going it alone through this, and the men that John has connected with who really step up, that is a big part of the process. And definitely, it's been good to share with women and men about the experience, particularly as the support person, whether that's in, you know, a heterosexual couple or another arrangement. You bring up a point that I was going to bring up exactly. Yeah, it's a really important role, that support person, as I'm sure it is during pregnancy. I mean, I don't know. Definitely. Absolutely. No, you're spot on. It's the same. You know, there are a lot of nowadays even single women who choose to go through IVF, and for them, you know, it's still important that they have people supporting them with this. It's such an emotionally trying time. I mean, the hormones are raging, you're undergoing physical procedures. It's that, you know, that often roller coaster of, you know, hope and despair and, you know, feeling like you're out of control. And it's just important that you've got someone helping you through that. And that's why I think it's so great that you've made it such an open discussion, so that people realise they can talk about it. And, you know, some people choose not to talk to everyone about it, but even if it's a close friend or a parent or a sibling or someone that can help you through it, I think that's absolutely critical. And it's really, really important. It's quite funny. What you were saying before just made me think of something when we talk about, you know, sharing the physical burden. I remember when we were having IVF, I had to have a single blood test done. And embarrassingly, very embarrassingly, as an obstetrician, I absolutely hate blood tests. I have a fear of them. And I remember the day I was going for my blood test, saying to my wife, you know, oh, I really don't want to have this done. And the stare I got from her is a look that I will never, ever forget. And I went and never complained once more, because when I realised that, you know, my part physically was so easy compared with everything she was doing, I felt sort of embarrassed and mortified afterwards that I'd even questioned having the blood test done. But, you know, it is true. I don't like it when he acts like it's too easy as well. Like he's got to go, oh, this really hurts. This must be really hard for you. Then it's okay. Absolutely. Fine. I'm like, that is not fine. Definitely. I completely agree. In terms of, you know, talking about, you know, you were saying that you've got, you know, a lot of siblings and they tend to fall pregnant easily, and you just chat with people about infertility and the next month they seem to conceive spontaneously. How do you guys sort of
find having other people around you falling pregnant easily. You know, I think it's a difficult thing to talk about because I think a lot of couples don't ever want to acknowledge that perhaps there is a little bit of jealousy or resentment or hurt. You know, you sort of put on this face of course we're happy for you, and you are, you know, deep down you're absolutely delighted and elated when people that you love get pregnant and share their news. But, you know, it's a very hard thing to watch other people, you know, getting what you want so desperately, so easily. How do you guys find that you deal with that? Very tough question to answer, I'm sorry.
It is an
important question. And we probably have different answers as well because we both experience it differently. I was just thinking when you were talking before how, you know, fertility treatment is only about 40 years old. It's not in our culture for a very long time. And before IVF, we would have just been, I guess they would have called it barren, you know. And so in a lot of ways we try to focus on the gratitude that we have to even have this opportunity.
Definitely.
And that, I do try to focus on that, you know, the fact that we even have this opportunity, even though it's difficult and it's hard, it's still an opportunity that wouldn't have been available to us 40 years ago. And the same thing when we think about how our families and friends react to us, it's new for them as well. It's not part of our culture. And
no.
Only sort of a couple of decades ago, people didn't speak about miscarriage or interruption or anything like that. So the fact this is a new movement. And so we try to give everybody the benefit of the doubt, even though it's hard. And people sometimes say things that are very insensitive, or they say things that are even cruel. And but we try to really hold on to that gratitude and that.
I do have to say though, everyone's intention is normally good and honourable and right.
Absolutely.
It's not their fault that they haven't had the experiences. Give them the tools to deal with our situation.
But to go back to the question though, because I've never before felt those mixed feelings when someone would announce a pregnancy to me. That was a new thing for me, and you know, by putting myself in relationship with John, suddenly that changed, and it was confusing. It was really confusing. I was like, I felt, you know, happy, but at the same time, just like I was losing some kind of imaginary race, you know, and most of my siblings are younger than me, and they're all, they had experienced some miscarriages. So, and then they all got pregnant the next month. And in some ways that was challenging as well, because they would equate what they had been through with what we were going through. And
absolutely.
Even though, like, miscarriages are obviously very hard, but they're different to infertility. And so people didn't quite understand. And look, we protect our hearts as well. We do what's right for us, which initially was keeping it secret. And then it was telling a few select people. And then it was having our Facebook group. And then it was, you know, we would prepare for a baby shower, or we would sit down together and be like, okay, how are we going to manage this? How are we going to, and it would be things like, okay, we're going to go at this time and we're going to leave at this time. We're going to have.
We did the exact same thing. I know the feeling very well.
We're going to have an agreement about, you know, when if one of us wants to leave, you know, we had plans. But by the same token, we would bolster ourselves emotionally to be like, how can we, because this isn't about us. This is about the expectant parents. And as much as we could generously give our love to them until we didn't have anything left. And then we would leave. And I remember very vividly being at a birthday party of one of my nephews. And there was this, oh God, I'm going to cry. There was a speech going on, and it was just beautiful. And we were so happy for the couple. And all John did was just put his foot out on my foot, just to let me know that we were in it together. And those little gestures make such a difference. And that's why having that support person, whether it's your partner or somebody else, and trying not to make it about you, and just trying to believe that if it can happen for them, it can happen for us too. And at some point, infertility does end. It has to end. It always will. It's going to end in a number of different ways. You're either going to have a child, you're going to adopt, you're going to decide to remain childless. At some point, it ends. So just knowing it will end and having gratitude to be in the process. So what would you say about that?
Yes.
Thank you for sharing that. I know it's a really hard thing to talk about. And I think that's probably the hardest part of the discussion to have with other people, because it acknowledges what other people consider to be weaknesses, I think, and that's a really hard thing to do. But, you know, we all have we're all human, you know, and that's why I wanted to talk tonight about the human side of IVF. You know, it's all well and good to hear from fertility specialists about how an IVF cycle works in a clinical way, and, you know, that you have a great chance of having a child. But what they don't talk about is what it looks like for you over that year or 2 or 3 or 5, and how it impacts upon the rest of your life. That's exactly right. And I sort of relate to it in that, you know, I am in a job where every day I look after people who are newly pregnant, and I was always delighted for them. And, you know, the excitement I don't think ever sort of wanes. I still get so excited after doing this job for many years now. I still get so excited every time I see a newly pregnant couple. I know how excited they are and what it means for them. But, you know, when we were going through our own, you know, fertility troubles, you'd have couples come in all the time, and I would, you know, ask, as I routinely do, you know, did it take you long to get pregnant? And the number of couples who would say, first try. I just came off the pill. I hadn't even had a period yet, and we're pregnant. And I found that really, really difficult. And now I've sort of turned it around in that I've used being on the other side of the fertility journey to really help look after couples who are going through fertility troubles, either prior to pregnancy or in pregnancy. Often once couples who successfully conceived with IVF, for example, they find themselves really anxious early on in a pregnancy because, you know, all pregnancies are precious. So I don't differentiate between them. But a lot of couples who've been through IVF have invested so much time, emotion, money in getting to that point that, you know, the thought of something going wrong for them is just so anxiety provoking that, you know, having been through it myself, I feel like when I'm looking after these couples, I can give them reassurance, and having that empathy and understanding that I sort of get what they've been through, I think they find that very, very comforting as well. But I found it very, very hard doing my job when we were going through infertility because, you know, there are moments where I used to sit there and think, I just wish that this was me. And it's very, very difficult. But you're right. I think, you know, you get through it and you realise that you're doing all the right things you can to put yourself in that position, and you're being looked after by people who can get you to that point. And I think it's very important to remain hopeful and optimistic. And I think, you know, you'd hope that the people looking after you will be realistic with you. And if they didn't think there was any chance of this working, they would tell you that, you know, putting you through what you're going through, unless there was a reasonable chance of success, is something you think they wouldn't do. So you can take a lot of hope and optimism out of that, and you know, it's a very hard thing to go through, but you're both doing a wonderful job of it, and I thank you particularly for sharing that story, because I know it's a really hard one to share.
Yeah.
I think just on
I have lots of things to add, but you go first.
Say through this as well, I've learned a lot in the fact that I don't know whether it's a typical guy or whatever. You just I've got a challenge, I've got a problem.
Yeah, I'm going to beat this.
I've already got 100 solutions.
Yeah,
and I'm going to fix this problem. And
absolutely.
I guess everyone's unique feelings or emotions that they have, and Laura feels, and she feels like no one I've ever known. Yeah. And from my point of view,
it's very diplomatic.
It is not helpful to just go, all right, just get over it. Let's. I've got another solution. Let's just fix it. So I think for me, like going to these parties and being around these people, I've sort of dealt with these things where it's been great to actually really feel and discuss some of the ways that obviously it's made her feel, not me. And then I'm like, oh, well, that's a completely different perspective. I never thought of that. And now I understand why you're acting the way you're acting, or why you've reacted. I'm like, that makes sense. It's not. So I think that's been huge. I've learned a lot, but I guess I've learned to listen as well a lot more to what is actually going on, and then going, all right. Yeah. Right.
Definitely.
I wanted to add as well that we have also set up ground rules around ourselves. Like we've told our friends and family what we need, because if you don't tell them, how are they going to know? So things like,
you've preempted my next question.
Right. Yeah. So things like, you know, I got to the point where my sisters were just sending me baby photos all day long, and while I'm trying to work, and I'm like, I can't have baby photos being sent to me while I'm trying to work. I love your baby, I love you, but I can't deal with that.
So I am going to jump in quickly. My solution. stop watching social media. Really helpful, by the way. Do not do that.
Follow our pages, yeah.
We do set up and we politely ask people and tell them what we need, because we figured out about a year in that if we don't tell people what we need, then they can't to us.
Absolutely.
The other thought that I had while you guys were talking was just, I know that everybody loves their babies, but man, how much are we going to love ours, you know? And
I tell you what.
in some ways, I'm sure everybody loves their babies equally, but people who've been through infertility, just a teeny bit. I'm sure that must be true, and I don't know yet, but I just feel like when you've worked so hard for something, and aren't we lucky to have that experience, you know? Aren't
Absolutely.
we lucky to have really, like...
Well, 2 years ago, I didn't think I was going to ever have my own kids, so that's why I actually worked with kids. I just took everyone else's and then gave them
Definitely.
back.
Absolutely.
And we're so excited by just staying in that grateful place. Just being like, man, aren't we lucky to have this opportunity? And one day when we become parents, somehow, some way, aren't we lucky that we've really wanted it so much that when we get it, we'll appreciate it? You know?
100% agree with that. And I often, I say this with being very genuine. I often look at my little girl and I think if we had have conceived on our own in any month prior, our kid would not have been you. It would have been someone else. It would have been a different egg. And I, you know, am just so madly obsessed with my little one that I am now at the point where I feel, you know, happy that this is how it happened, because she is who we got and she's just perfect in my eyes. So, you know, that's how I look at it and say, you know, going through the, you know, however long we tried for on our own and it didn't work, that was worth it because we got her. And that's, you know, something I would never, ever change in this world. So I think you'll feel the same when you get to finally meet your little one and ones.
I think so. And when we can tell them how much they cost as well. We can
Absolutely. Oh, yeah. We've got a little book. Definitely not. But no, absolutely.
For a child to come into the world that way and know how wanted they were and how much they fought for them, like that's beautiful too. You know, all pregnancies are beautiful, as you say, but an infertility pregnancy is really beautiful as well. So
I couldn't agree more. So for family and friends of yours who say to you, look guys, we don't want to interfere, we don't want to intrude, what do you want from them? How do you find your family and friends can best support you? Do you find it's best to have it on your terms and you say to them, look, we'll talk about it when we want to? Do you say to them, happy for you to just check in and say, are you okay? What feels right for you? How do you sort of find that you can be best supported by the people that really care about you? Is it wanting help physically when you're going through your procedures to say, can you cook some meals for me? What is it that you find most helpful and useful?
Yeah, I think
it's more probably me who needs the support. John's family's interstate, so they support us by calling and checking in.
Great.
And the challenge with anything...
A couple of bills have been fixed up and
fantastic.
Like that.
Great. Really good.
And look, there's a big part of this as well where I try not to rely too much on other people, just because I don't want to be disappointed. I don't want to be entitled to any kind of support, but I'm grateful for support that shows up. And I think it's been challenging for my family and friends to really know what to do. The hyper fertile family that I come from, they had no confidence, you know. And so it's taken me the whole 2 years to figure out what to ask for. And and it changes day to day. Sometimes you want them to ask questions and talk about it, and some days you just don't talk about it. And that's like any kind of... Because this is the roller coaster of hope and then grief and then hope and then grief.
Well, that's why we created that one place as well. We could just put whatever happened in there, and instead of having 10 siblings or 9 siblings and all of my family asking the same question, and we're having to... So
the biggest one, I think, would be to educate themselves. So we found it really exhausting to keep having to explain how IVF works. So if you're supporting someone who's going through IVF, one of the biggest things you can do is just educate yourself and not always rely on asking questions of the couple or
and each journey is unique too. Each journey is a little unique. It's got a little tweak.
So just, you know, there's great documentaries on Netflix and stuff like that. Like, educate yourself in the first instance, and then it would be just the same way you would handle any other grief or hard times. You know, like cooking is great. You know, financial support is great. Just sometimes just saying, hey, do you want to talk about that today or not? You know, those kind of things. For me, it was just being respectful around the babies and stuff, just being aware that I couldn't have photos of babies sent to me all day, things like that. But my family and friends are still learning. I would say they haven't always been great at it. And that's just being honest, I guess. But for us, it was also not being entitled to, you know, people have got their own challenges they're going through.
Absolutely.
The other thing I found challenging was, you know, when someone suffers a loss or, you know, some kind of hard situation, it often lasts for a short period. The thing about infertility is it goes on for years.
It does.
So it's been challenging for our families to know how to support us long term. Like,
absolutely. Someone's just posted here saying that she and her husband have unfortunately been trying for 13 years with secondary infertility, and it's exhausting to have to keep on explaining how the process works. And, you know, I endorse that completely.
Yeah, that's why I think it's not what people expect to hear, but actually educating yourself would be the biggest step.
Well, just even
definitely.
The process.
Because then when you say I've had an egg retrieval, they don't go, what's an egg retrieval?
That's right.
That to me would be the easiest, because I always feel like I'm having to explain it. And honestly, a big drive between us making a YouTube channel was just to explain it, so we don't have to keep repeating.
So brilliant. Really, really great idea. I remember when we started going through IVF, we used to catch up with my family once a week for dinner. And I remember saying to my parents early on, you know, if we don't come 1 week, it's just that we just don't feel up to it. So, you know, we don't need a million questions about how are we feeling and, you know, how's it all going. The greatest support you can give us is to just say, not a problem at all. When when you want to talk, let us know. And that was what I found very useful. And, you know, I'm very lucky, you know, my wife and I both have amazing families in Melbourne who are so incredibly supportive throughout the journey. And I don't think we could have done it without them, but they were very understanding at the same time that we talked to them about it when we wanted to, and just checking in every now and again and saying, is there anything we can do to help, was sort of what really helped us a lot.
Yeah, just asking questions in a way that's not pushing the issue.
Absolutely.
And
just that general support. Absolutely.
Even if unless someone asks you for advice, it's not your role to offer advice.
Exactly right.
Advice from great people. So.
And if you do ask the question, be ready for the answer.
For the answer, exactly right. Absolutely. And I think, you know, comments like, you know, you must just be really stressed by everything. And I think maybe if you just took a bit of time out and just relax a little bit, just go on a holiday, you'll get pregnant on your own. Those sorts of comments are not particularly helpful, are they?
That's broad brushstrokes. And
it is.
To actually just ask that little question, go, oh, well, okay, well, tell us a little bit more about your situation. And then, but again, like I said, be ready for what's coming, because it can be quite overwhelming.
And for us as well, I think being aware that support can come from unexpected places.
Yeah.
It may not be the sister that you've been close to your whole life. It might be the auntie who's never had children and you never knew why. You know, I've had people come out of the woodwork that I was like, wow, I never knew that that's what you went through.
Hadn't even thought about it. Yep.
Yeah, and I think that's been a really nice surprise, is to just see the people that I thought were going to be the supports through this maybe weren't suited to it. They weren't at a stage in their life where they could support us, you know.
Definitely.
Because they're focused on their newborn or whatever. So you find the support where it's needed. And
absolutely.
Before as well, like, I'm so excited that we are now somebody that people come to when they have a question about this, because they know that we have a lot of knowledge. And I think everyone
made it nice and open too.
Brilliant.
The coolest people I know in the world are the people who've been through some kind of challenge. Yeah. And, you know, we've been through different challenges, you know, John with his cancer and all kinds of things. And it just makes you a stronger, more interesting person. So I hope that this will add to our story in that way.
Absolutely. Now, we don't have too much longer tonight before our Instagram times us out, but there was one other thing I did want to ask. Obviously, I think for couples and going through IVF, or any fertility struggle, it becomes very consuming. It takes up a lot of your time and energy and effort. And I think it's really important to try and maintain some sense of normality outside of what you know fertility means in your lives. Do you have any advice for couples going through it about what they can do to try and, you know, stay grounded and you know, not let it completely take over, because it can be just completely consuming?
One of the things that's been really interesting about filming some of our conversations about IVF is that it helps us have designated times when we talk about it. So we don't like, I bring it up quite a lot, to be honest, but we do try to have, like, we're going to sit down now and talk about it, and then we're not going to talk about it for the next 3 days. And that, like, now I've gotten better, particularly with guys. Like, you have to really say to them, hey, I really need your attention right now, because we fight about it. And then give them a time limit. I need 20 minutes. Can you give me your attention for 20 minutes? So that's my biggest advice for the women, is because we ruminate it on all the time, and we want to chat about it, and we connect by chatting about our problems, right? That's how women connect with each other. Men don't connect that way. So being able to say to John, I need to talk about this next decision we have to make with IVF, or, you know, and it's going to take about half an hour. Can we sit down and do it? And for us, that's really been solidified by the fact that we also chuck on the camera and capture what we're talking about.
Great.
I will say, though, sometimes she'll come out and I'll realise, like, I'll be doing something and I will have to go, yep, fine, I need to finish this, because we are very single focused. I need to finish this, and then can we do it then? And she'll go, all right, and off she'll go, and we'll meet
as long as there's some sort of commitment that it will happen.
So I would say having designated times to talk about it. Being clear with each other about when you really want to do a deep dive and when you need a break from it. The other thing I found really useful is having, like, a fertility acupuncturist or a masseuse who is also a support, so I'm not constantly only relying on the one person.
Perfect.
That's worked really well. I keep in my phone a list of questions that I want to ask my doctor, so once I've written it down, I don't have to think about it anymore. That helps to keep everything organised in a spot. We have a fertility folder where both of us put papers relating to fertility, so that's all in one place.
Great.
What do you recommend?
I think routines as well. If you've got some stuff that you like to get done, and I like to meditate, I like to play drums, things like that. A journal as well. So some of the stuff some of the questions that I get during the day, I'll just ramble on about it in my journal.
I also like to give myself, I literally allow myself times to fall apart. Like, make that okay, but say tonight I'm just going to fall apart, and that's okay. And then tomorrow I'll go back to work and I'll do whatever I need to do. But to make it okay to sometimes actually fall in a heap, or also, you know, especially with the cycle, like if you've got a transfer, you know that you're going to have...
Or if it's day 7.
I wasn't going to bring it up.
You never know sometimes where you're going to be hard. Actually clear some space for those times, but then also go out with friends and say, okay, I'm not talking about infertility tonight, you know.
Absolutely.
For me, having designated times and areas helps.
Fantastic.
We do go and have a sandwich after an egg retrieval.
Yes, reward yourself. When I have a horrible medical procedure, I have to get a treat. And he usually has for it.
I think that is so important. It's the same I say to my pregnant patients who have the awful glucose tolerance test for diabetes. Once you're done, go out and have the best donut or ice cream you've ever had. So treat yourself, you know, recognise that you're going through, you know, a lot, and, you know, give yourself some rewards along the way, not only at the end, you know, with the reward of a child at the end of it, but, you know, recognise the small steps you take towards that as being an achievement in themselves.
We had to really learn as well to congratulate ourselves or really celebrate. So getting one egg, try and celebrate that, even though it feels like not enough. It's one, you know. Like,
it is, and it's moving you that little step closer towards your end goal.
And it doesn't mean you don't have to feel that little bit of disappointment, but you go, all right, we are one closer. We are
definitely.
This is a real sort of messes with your mind, but even a failed transfer is still one step closer. As hard as that is to understand, it's still one step closer. So celebrating that you're one step closer, you've learned something new about your body. You know, you've learned something that doesn't work.
Absolutely.
A step closer. And it's really hard to see it that way.
It is.
If you can, it makes it livable.
It does take a little bit of time. You know,
it does. You've got to build resilience. Absolutely. I completely agree. Well, thank you both so much for your time tonight. It's been an absolute delight talking to you. And thank you beyond sort of just the talk tonight for everything you do to support couples struggling with fertility. I think it's so important. And I certainly hope to chat with you outside of this particular forum about what can be done to help or to continue to help couples going through all of this, because as I said, I feel very, very passionate about it. I know that you've got a brilliant Instagram page, obviously, and I see that Lynn has just joined there as well, and is obviously delighted to be to see you here tonight. How else can couples or women going through fertility problems access your resources? So I know you said you've got a YouTube channel as well. What are the best ways that people can access all of it?
I'll leave that to you.
Yeah. I'm the millennial. He's a bit older.
Yeah.
Excellent.
So we have our Facebook and Instagram is Infertility Man. We have a website that's infertilityman.com. There's a lot of stuff women in there as well, but we did want to sort of highlight the men's experience, especially because we have manufacturer infertility. And then our YouTube channel is called John and Laura. But if you go to our website or our Instagram, you'll find your way there. And yeah, we're always happy to meet people. We have a lot of people send us messages. We're always happy to chat about things. But yeah, infertilityman.com is where we're at. Brilliant. And we want to say thanks to you as well. I mean, the work that you do is obviously having a huge impact.
Thank you very much.
And I love it how doctors are sharing more in these kind of formats, because it helps lift the veil a little bit on what the experience is like. And hopefully we will get to chat more one day and you can deliver a baby for us.
I would be absolutely delighted, my friends, and hopefully that day comes sooner rather than later. But, you know, I have found that sharing my own story with my patients has been so helpful to them. And, you know, initially I was reluctant to cross that sort of personal and professional boundary, but I think it's been an important thing to do. So, you know, again, thank you for everything you've done, and good luck. Someone posted a bit earlier, it's come off the screen, but that you're going to make absolutely wonderful parents, and I completely echo and endorse that sentiment. So good luck with everything at the moment. I know it's sort of a trying time for everyone, but keep doing what you're doing, and I look forward to chatting to you both soon.
Yes, thank you. Thanks for having us.
Take care. Stay safe. See you later. Keep making your masks. All the best. Bye-bye. Take care. Bye. Bye. Hi everyone, good evening, and thank you for joining me tonight at what I know is a pretty challenging week for everyone, you know, across Melbourne. Obviously with things escalating as they are, it's been a really stressful time for everybody, and I'm really grateful that a number of you have managed to join me tonight. I think it's sort of important equally at times to focus on non-COVID related news, and to sort of remember that in some ways, you know, life really has to continue, and it's nice to be able to hear about other things and to talk about other things. And I'm really glad that you're able to join me tonight for a chat about a topic that I'm very, very passionate about. And my passion for this area derives not only from my professional interest in it, but also from my personal interest in this sort of in this field. As I think a lot of you know already, I'm a very lucky dad to a beautiful 15-month-old girl. She's 15 months tomorrow, in fact, who is the product of IVF. And my wife and I were one of the 1 in 6 couples who suffer infertility, and having been through it myself, I feel a real empathy for couples and women going through fertility struggles. So I'm absolutely thrilled that I am joined tonight by the wonderful Laura and John, who themselves are going through infertility, and the